5 years ago, the World Health Organization declared COVID-19 a global pandemic. What began as a mysterious illness quickly spiraled into a worldwide crisis, bringing life to a halt. Today, as we reflect on those early days, the impact of the pandemic is still deeply felt, and many lessons have been learned along the way. They were numbers presented nearly every day. Daily reports of new cases and deaths highlighted the virus's devastating toll. According to public health data, approximately 60,000 Canadians died from COVID-19, with many victims being residents of long-term care facilities.
Primarily, we were very, very slow to respond to their safety. And we put our teaching hospitals way ahead of long-term care, even though the risk to those people was far higher.
The situation became so critical that the Canadian military was called in to assist 7 long-term care homes in Ontario, where they found horrific conditions, including feces and vomit smeared across floors and walls. Bioethicist Carrie Bowman calls this one of the hardest lessons learned during the pandemic.
It was wrong. It was a serious violation, and a lot of older Canadians died because of it. So that was very problematic.
Another crucial takeaway was how little was understood about the transmission of viruses, especially COVID-19. Early on, the idea of airborne spread wasn't fully acknowledged. Experts say that changed dramatically.
Prior to COVID, we didn't really talk about airborne spread of diseases. We acknowledged that it happened for measles and tuberculosis, but as a general rule, we assumed that most people got sick because of contact.
The pandemic also left deep scars on the healthcare system, the effects of which experts say are still being felt today.
We've seen more privatization as a result of COVID. We've seen more people leaving the healthcare system because of the pandemic. And so I think COVID will have left a deep, lasting scar on the healthcare system.
While significant progress has been made, public health experts stress the importance of continued vigilance and preparedness for future global health threats.
That is not our last pandemic. And I don't know when the next one is, and neither does anyone else. But bird flu is out there. I'm not saying it's the next pandemic, but it's a huge threat. We don't know. And I would say we need a national independent inquiry because we really have to shine the light of day on this. We have to do better next time.
Nakhavoly, City News.